Children, what would you do without them? They have the ability to bring joy and laughter to everyone. They remind adults not to take life so seriously sometimes. But how would you go about when a child appears to be very timid and withdrawn from their surroundings? I hope you will be aware at this point that this child could possibly be receiving maltreatment from their caregivers. If you still are not sure, please keep watching to learn more about how to pick out these signs and how to help intervene, as well as finding treatment options towards these children. Why should I be concerned, you might ask? Joy Diosofsky underlines that physical abuse is the leading cause of death among children less than 1 year of age in this country. Homicide accounts for 10% of all deaths of children between 1 and 4 years. 1/3 of all victims of physical abuse are under 1 year of age. 1/3 of all sexual abuse cases involve children under 6 years of age. The numbers of cases in domestic abuse as well as sexual violence on children are overwhelmingly high. The only solution to prevent these situations would be to spread the awareness and take action when signs of abuse or neglect begin to show on children. Child abuse occurs when caregivers intentionally cause harm to the physical, cognitive, or emotional well-being of a child. Some signs that may help indicate if a child is getting abused would be the increased vulnerability to head and brain injury, the failure to form secure attachments to primary givers, such as the lack of separation anxiety and stranger anxiety, as well as being open to abuse and manipulation by strangers. In addition, children that have frozen watchfulness and passivity, as well as less interaction with the environment, for example, inhibiting their sensory-motor exploration, as well as having cognitive delays, all may be signs that a child may be undergoing physical abuse. Child neglect occurs when caregivers fail to provide for the physical, cognitive, and emotional needs of a child. Some characteristics of a child getting neglected would be poor muscle tone and failure to develop basic motor skills, generalized cognitive delays, such as the lack of curiosity and motor skills. In addition, a child showing cultural familial retardation with no obvious genetic or cognitive issue with the child. Once these signs of child abuse or neglect are confirmed, it is necessary to take the next steps of intervening. Ways on how you may intervene can be approaching the other person at a time and place that is safe and confidential. Start by expressing your concern, such as, "I am concerned someone may be hurting you, and I am worried about your safety." Take the time to listen and believe what the child says. Communicate that you care about the child's safety, that they do not deserve to be hurt, and that the abuse is not their fault. Tell them good things about themselves. Let them know you think they are smart, strong, and brave. Their abuser may be tearing down their self-esteem. Encourage them to build a wide support system. Help find a support group or encourage them to talk to friends and family. Do not feel the need to be an expert. Do not try to provide counseling or advice, but do connect the child to trained people who can help. If the child needs immediate help, don't hesitate to contact child welfare services to prevent anything worse from happening. Together, we can work to spread awareness of domestic violence on children. Children as young as 1 year cannot speak for themselves yet. That is where we, as the adults, have the responsibility of speaking up for them if they were to be maltreated.